So now you've learned about the basics around cannabis, but how is it even consumed? Let's talk about that next. There are a variety of different ways of consuming cannabis, but we're going to talk about the two main ones, which are oral inhalation as well as ingestion. And both of these have different effects on the person consuming. So what do these different methods of consuming cannabis via inhalation even look like? Well, one of the most common ones is joints, which is ground up cannabis flower or cannabis bud that's rolled in regular rolling paper. And some people put tobacco in their joints as well. Blunts are following the same principle, but use either cigar paper or tobacco leaf and can contain some nicotine because of that process too. You can also consume via pipes, which are small handheld devices that contain what we call a bowl, and that's where you pack in your cannabis, you light it, and then you inhale the smoke that comes from that combustion process. You can also consume through water pipes, so things like bongs or water bubblers that have some water at the bottom of the device, which means that when you're inhaling from the bowl, it goes through the water and has an overall cooler effect. However, you're generally inhaling more at a time, and so the hit overall can be more intense. Edibles can be quite potent in THC, which means that the risk of overconsuming is higher, particularly also because it's easy to underestimate the effect that it's having due to the delay in the onset of that effect. Metabolism is also really different from one person to another, as well as according to external factors. So it's really important to start low with a small dose, go slow, and be patient with yourself with respect to that effect and getting used to how that feels to you. When your liver absorbs THC, it's converting it from delta-9 THC to 11-hydroxy-THC, which is more psychoactive and can produce a stronger high effect. In addition to these two main methods of consumption, it's also possible to consume cannabis sublingually, so under the tongue, as well as through topicals, so products that are applied to the skin.